when you've had serious health events happen where you could have been in serious trouble, that fear of being told you look fine and then having it be missed, I think it's terrifying. I cry before appointments. I'm a hot mess. Like, I'm really good being the healthcare provider. Me in my role as an osteopath, I love that. I'm happy to advocate for my patients, and you know, I try and support them. When it comes to myself, the anxiety is so bad.
I mean, advocating for yourself is a whole other thing. Like, I would fight for anybody else.
Yeah.
But me, not so much. It's really, really hard to stand up for yourself. And I think it's the reason that, I mean, particularly so many females just get told, well, sucks to be you. You know?
You're fine or whatever. And I think sometimes too, people see like you can walk and you can do this, and it's like you've had to use every fiber of your being to be able to do that. Hey, I'm Hypermobile, and if you're listening to this, I'm guessing you might be too. Hi, my name is Alex, and I'm your Hypermobile host, and today we have on the wonderful Ellen. Hey, Ellen.
Hi, Alex.
So you come on today to talk about a lot of things. Firstly, you're doing some really cool things in your studies right now. We'll get into that in a sec. You want to be a criminal lawyer, which I think is wild, but we'll have to talk more about that in a minute. But you're also hypermobile, like most of my guests. Actually, haven't had a guest on yet who's not hypermobile.
Look at us all go.
100% hypermobility. We're going to break that soon. One of my guests this season is not hypermobile, so he's going to mess that up. But we're good so far. But yeah, and you've also been through like a lot. There's a lot in your journey, and you know, everyone's journey is complex, but some people's journeys are complex in different ways. And I just think you have so much really incredible experience to share, and it's just been a privilege to get to know you both as a person and as a patient.
Thank you.
I have to say. So before we get into things, tell me what's going on with your studies right now.
So, my first degree, my bachelor's degree, was in criminology and security studies. I went on to study a master's degree in international security and terrorism. And then, as you know, as everybody else will get to know, life changed dramatically. So I got my master's degree 4 years ago now, and I'm back to studying after a long break. And I am doing a conversion course into law, so a postgraduate diploma of law.
Oh, that's so exciting. And you want to work in criminal law?
I do.
Is there a reason why criminal?
I mean, as you can see by my track record, I've always wanted to end up in the criminal justice system.
Yeah.
So criminal law just seems like the right way to make a difference. And I hope it's something I'll be good at.
I love that. I'm so excited for you.
Thank you.
Going back to that really challenging period, I feel like we should go back a bit further potentially.
Yes.
So you are hypermobile, and when thinking back in your life, when did you first start to notice signs that hypermobility might be something that affects you?
Well, looking back now, there's so much that should have been red flags. I think as a child, I had a lot of experiences that, knowing what I know now, it's blatantly obvious, but they were all treated as separate issues by doctors. You know, I was diagnosed with a weak ankle. I had inflamed hip joints. I ended up on crutches for months.
How old were you then?
About 10.
Oh,
yeah.
10-year-olds should not be on crutches. There should be proper investigations done.
Yeah, well,
at that point.
I know. 10-year-old me thought it was quite fun on the crutches, though. So, you know,
I was intrigued by them too. And I was
right.
Yeah,
it's like a thing.
It's a thing.
Yeah.
Tell me a bit more. Was there other growing pains? I think we might talk about that before as well.
Yeah, lots of growing pains. There was also lots of general pains. I've always had headaches. I had days and days off school from such a young age because I had migraines, which were very likely actually not migraines.
Yeah. And the growing pains, I want to be clear, growing pains do not exist. There's a really great paper. I'll try and put it in the description. It's a scoping review of growing pains. And as far as I know, I think the paper was published, I want to say 2022, but check the date. There's actually no consensus on what growing pains are. And the NHS definition, so the UK public health governing body, they say on their website, as of today, whatever today is, September 19th, 2025, they say it has to be pain felt in the not in the joint. So in like for example, it would be more in like the calf or in the leg versus deep within the knee, which is the classic place I hear about it. In terms of patients and younger patients that I work with, they have to resolve by morning. Again, a lot of patients are waking up, these younger patients, and still having them during the day, and they need to stop occurring. I think they say age 12 or something, and the amount of like 20-year-olds I see.
I was just gonna say that I still get them. I still get awful cramps in my calves, in my thighs. It's awful.
So were yours more in like were they in the knee itself, or kind of lower down?
Lower down, going, it like radiates into the knee.
Okay.
Yeah.
Okay. That's no, it's interesting. Some people it's like exclusively within the joint, and then even more so when they're told it's growing pains. I'm like, that does not fit with the NHS definition. But yeah, no, growing pains, I have a lot of issues with that. We'll do a whole episode on that topic one day. That is my like campaign if I win the lottery, to do like a growing pains awareness discussion of what they really are not and why it's a misuse label. And it starts to normalize chronic pain in children. Mm-hmm. Like, did you find that happen to you?
Oh, absolutely. Yeah, absolutely. Yeah. And like I said, everything was just treated as a separate issue. Nobody ever linked everything together.
You're also so not the first person to say it. You are literally the, I think, 5th guest now to be like, everything was treated as separate issues.
Yeah.
And it's a recurring pattern. You also said you had weak ankles as well. And I have to say, sorry, there's a lot of language issues here. Nothing like you've done wrong. But I hate when people tell like young people, oh, like you're weak, like your ankles are weak. I was told I had a weak jaw as well, which is really annoying to describe my overbite, which was a big problem for me, which I actually had surgery for. But your ankles were not weak. You were hypermobile.
Yeah. As I learned. Yeah.
So then you went through kind of your teenage years.
Yeah.
What happened from there?
The same kind of pattern as my childhood, really. There was more and more issues. I had severe dental issues as well. I had a lot of overcrowding in my mouth. I had, a vast amount of orthodontic work done to fix my teeth.
Do numbing injections work on you?
I'm a redhead, so,
But there's actually clearly published research which demonstrates that local anesthetic does not work as well in people who are, this, right?
Yeah.
There's a BBC news article as well, which is like my favorite thing to share with people because it's easy to read. It's more fun than a research paper.
I love a BBC article.
I will link that in the description too. But so you had a lot of dental work going on. We'll touch more. I know you mentioned period issues and other stuff, and we'll get to that at the end because you and I have thoughts on this type of thing.
Don't we just?
Yep. Gut issues as well?
Gut issues ever since I was a child.
Yeah.
Same thing. Yeah. And then when I was about, I think I was 14, 15, I looked in the mirror one day and I realized my shoulders were uneven. And I was then diagnosed with scoliosis as well. And it was severe scoliosis.
I think you mentioned that you went downstairs when you told me the story the first time, and then you showed your mom.
Yeah.
And I know your mom, by the way.
Yeah.
I adore your mom.
And you and me both.
What tell her I say hi. But what did she say like when she saw it?
She immediately just said, yeah, we need to go to the doctor. It was blatantly obvious. I can't believe that nobody caught it before then. I think when we caught it, we were already at a 50-degree curvature.
Yeah.
I can't believe I didn't notice beforehand. I've always had pain in my back. I could never support myself, like sitting up. I'm always leaning against something, but I just never thought anything of it.
I wonder sometimes people who are hypermobile, and I'm quite tall, so I would always kind of curve my body in different ways. Like if I had a boyfriend who was shorter than me or whatever, friends that were shorter, I'd always like stand in a weird curved position. Maybe that was how you hit it. Like maybe you were doing stuff like that a little bit.
I don't even know. I think the only reason that I realized was that I had a very close friend of mine who'd had a spinal fusion.
Oh, wow.
The year before.
And she was young then.
She was young. She was a year older than me, but I think she got it done kind of 14, 15. And the worst part is that I remember at the time thinking, thank goodness I never have to go through that. I think I jinxed myself. I really set myself up for failure there.
Oh dear. Did you talk to her? Yeah.
We're still friends today.
Are you serious?
Yeah.
That's amazing. Is she hypermobile?
As far as I'm aware, she's not. As far as I'm aware. But
All right.
Her spinal fusion was very successful. So
good. So what happened with you? So you have this 50-degree scoliosis.
Yeah.
Your mom, who's like no nonsense, she takes you to a medical doctor, I assume, to be assessed.
Yeah.
What happens from there?
I think we went to my GP first.
Okay.
Who confirmed that we needed to go see a spinal specialist. And then because we already had a friend who had used that spinal surgeon, we went to him. And he confirmed that it was a severe curvature and that I would need a spinal fusion.
Yeah.
And he said it would need to happen soon because they didn't want the curvature to get any worse. They braced me, but bracing does very, very little. It was very uncomfortable. I was a teenager going to school. You know, it was just very impractical.
Yeah.
But it also hurt.
Where did it hurt?
I mean, my shoulder was sticking out. It still does stick out. And so it was like pushing that in. It was like the bone pushing against the hard plastic brace was so uncomfortable. And, you know, what 15-year-old wants to go into school wearing a massive brace? This is not like, you know, a little brace. This was like a huge mold of my body. And it was heavy.
Yeah. I
Yeah.
can't imagine how hard that must have been.
It was not fun. But yeah, so they did the bracing thing. Surprise, surprise, it didn't stop the curve progressing.
Yeah.
And I think by the time I got surgery, we were close to 70 degrees.
Okay.
But yeah, the surgery happened. It was traumatic, to say the least. It was not fun. It was painful. But I did it. I had my mum with me the whole time who, I mean, you know, she is.
I wish I could bring your mom to my appointments. She's awesome.
I know. She's great, isn't she? She is.
I should describe her for the audience. She's relatively petite. Like, she's not that tall, right?
She's petite.
But she's just a very strong woman. And I was so happy when you brought her to your appointment. Again, I always encourage patients to bring people with them. You bring as many people as you want. As long as you're okay with them in the room, I'm okay with them in the room. And your mom just gives off this very protective energy, which I love.
Yeah, she's my biggest advocate. Seriously, I don't know what I would do without her. She comes with me to all my appointments, mainly because I'm not always able to like process information the way that I, you know, brain fog and all that fun stuff.
Well, I have to. Sorry, go on.
Yeah, but she is my biggest advocate, and I'm very grateful.
But I have to hop in for one sec before we get back to your story, because there's still a lot to come here.
Yes.
But when it comes to bringing someone to your appointment too, like, you never have to be apologetic or think of a reason why. I think inherently it is a power imbalance. We have an expert on one side, the healthcare professional, we have a patient, and you're expected to just understand and process everything and make decisions in an instant. Whereas my boyfriend's in law, and in the legal profession, you would never engage like with another lawyer without a professional representing you, and a lawyer to represent you and help make sure you understand everything that's going on. So I think it's actually critical. And I think everyone should always, as much as possible, bring someone with them 100%.
Yeah. I mean, it's an intimidating situation as well. Walking into an office of the doctor you don't know, or a medical professional you don't know, is scary.
Absolutely. And just having a body in the room, it just helps to shift that power imbalance. It really does. So as one of like the expert people myself, like I always try and bring someone. I've told my boyfriend, he's like, I don't need to go with you. And I'm like, no, I don't care if you stay in the corner and you just like you know, like a plant. You're just going to stand there and just be mildly intimidating and just make sure that I'm not messed with, basically. So,
As you should. Yeah. I love it.
Absolutely. So you had your surgery, and I know that there were some issues there, and that you didn't have the same outcome your friend had. And I didn't know about your friend's story. So that's added a whole other layer of like trauma to it, to be honest.
Well, after that surgery, as far as I was aware, as far as anyone was aware, everything was fine. I went on to live life like I had before, you know, with the pains that were unexplained and things like that. But as far as I was aware, everything was fine. You know, I had no idea that I had underlying health issues. I had no idea that the spine was, in fact, very far away from fine.
So the recovery post-surgical was okay, seemingly.
Yeah.
And I'm going to jump in real quick and do a disclaimer. I always forget to do a disclaimer at the start. There could be some swear words. I don't know. We'll see how we feel. This is not medical advice in any way, shape, or form. Please speak with your appropriately qualified healthcare provider or medical doctor for that. And this is just your experience and your story, okay? So this is not medical advice. But please continue. So things were okay post-surgery.
Yeah.
And then when did you start to realize things weren't okay?
I am terrible with dates, so take everything I say with a pinch of salt.
Dates don't matter. Yeah, it's fine.
But years-wise, I'm going to say kind of 2019, 2020, things started to decline.
So how many years after the surgery?
It was 2015 when I got the first one done.
Okay.
So 4 or 5 years later, I think it was about 19, 20. And it was a slow decline at first. I was feeling more tired than usual. I was in pain, but not in any particular area. It's just everything hurt.
So it wasn't like your back was hurting, it was just like your whole body hurt?
No, at first it was more of a general, just like, I just didn't feel well. That's the only way I know how to describe it. I just didn't feel myself. And we, keep going a few months down the line, and I get this headache, and this headache has never left. I have had a headache for like 5 years straight now. And they are less intense than they were back then. Back then I ended up in A&E because of these headaches. I was hallucinating. I couldn't stand up because I was so dizzy and in such a large amount of pain. And eventually we realized, hey, something is really, really wrong here, and we need to start figuring out what's going on.
Did the healthcare providers who assessed you help support you in that, or was it kind of you and your mom figuring it out?
It was me and my mom figuring it out. Yeah. I went to the hospital with these headaches and was essentially told that there was nothing they could do. And I was like, okay, what are you supposed to do, right? I think she gave me a migraine headache pill and said, try this and see if it helps.
Okay, so they didn't do any medical imaging or anything? Just out of curiosity. Okay, so it's kind of
but
like...
she said to me, and I remember these words because, how do you forget these words? She said, if I were you, I would want an MRI done.
Yep.
But we're not going to give you one. And
I appreciate her saying that, at least. Yeah. I think it's a really difficult situation. I understand the stress that NHS is under. Yeah, like, again, absolutely. I don't want to sound judgmental, but people need to be protected and kept safe. And in your case, you felt there was something wrong. You were having some really concerning symptoms. That's not normal. No. A woman who's 20. And you had that previous surgery as well, which for me, it's a flag. When I do someone's medical history and it's like, oh, you've had this surgery. I'm someone who had a rare bone infection issue 5 years after my jaw surgery. So it's like things can sometimes happen that relate to surgeries years after.
Yeah.
Tell me what happened in your case.
So all of these issues combined, we went to a pain management doctor because what else does one do? We also saw a spinal specialist. The first spinal specialist that we saw took imaging of my spine and said that there was nothing wrong. Obviously, our first thought was that there was something wrong with my spine because the headache, my neck was hurting, my shoulder, we were like, it's something to do with the spine. And then we went to a pain management doctor who, mind you, this was during COVID, so it was an online appointment.
Yeah.
And he diagnosed me with fibromyalgia and chronic fatigue syndrome. And so we kind of stopped there for a while. We were like, okay, well, this doctor says that's what's wrong. We've had imaging done of my spine. Everything is fine. You believe what a doctor tells you.
Yeah, and that's the reasonable thing. You did nothing wrong, I want to say, right? Do you mind if I ask what type of imaging it was? Like X-ray, or did you go in a loud, noisy machine? Or...
It wasn't an MRI.
Okay.
Or maybe it was.
That's okay.
No, it was an MRI. Yeah, I remember now because I don't like MRIs. I'm claustrophobic. Yeah. It's horrible.
They are an experience.
Yeah.
Okay, so they saw nothing, and then I'm guessing that you felt like something continued to happen. You didn't feel quite right with that diagnosis of fibromyalgia.
Yeah, I think, and this is something that I always come back to, even now, is that I wanted to trust my gut. I knew something wasn't right. My mum, more than anyone else, knew something was not right.
Yeah.
So we found a second spinal surgeon.
Good.
And we went to see him. He took imaging of my spine and said to me, and I mean within 2 minutes of us walking in, he said, I know what's wrong. And me and my mum looked at each other and we were like, we knew it. We knew something wasn't right. And he found that the previous fusion had failed and that there was some like hooks in my neck. I mean, me personally,
it's okay. Don't worry, the mic has survived. But yeah, there were some bits of metal kind of in the place that we wouldn't expect.
Yeah, we were just a bit confused as to why there was hooks in my neck. And anyway, to this day, I'm not really sure what was going on there or whatever, but it doesn't matter because we're no longer there.
Good. So you had a second spinal, basically what do you call it, a revision surgery, a second spinal surgery as well. We haven't even gone into the hypermobility stuff yet.
No, but that happened in the same appointment, actually.
Really?
Yes.
Tell me about that.
This was quite the appointment for me. This was quite a day. We were talking about scoliosis, and he kind of looked at me and he said, yeah, it was quite common in people with EDS.
Yep.
But we had no idea what EDS was. We had never heard of this before. And he explained to us that by the way that I walked, the way that I was holding myself, my skin, the way I was sitting in the chair, as well as like my general health, I guess, my fatigue, my pain, he said that I needed to go and get assessed for it, and that he felt that it could explain quite a lot about what was going on with me.
Yeah, he sounds very sensible. By the way, speaking of sitting, you're welcome to sit cross-legged. You can take your shoes off. You can put your feet up.
Thank you.
Are you comfortable?
Yeah, I'm comfortable.
Okay,
yeah,
cool.
I'm comfortable.
Isn't the pillow on the lap nice, by the way?
Yeah. It's always, I think it's like a supporting my arms thing. It's my default position.
I call it position of true rest or supported rest. You know, like the towel thing. Elevating. I'm all about that. I almost got a towel today because it has been a week. Yeah. Anyway, so you then have that second surgery. How did that second surgery go for you?
I mean, he is an incredible spinal surgeon. He did a great job. He did exactly what he needed to do, and he fixed what was wrong.
Yeah.
Internally. However, my body did not like being operated on for a second time.
Yeah.
It was a surgery that was necessary. We could not leave it how it was, especially when there was the chance that it could solve my headaches, which it didn't. But we couldn't have known that.
Yeah.
And it needed doing nonetheless.
Yeah.
So, yeah, my health declined even more after the second surgery. I was so ill. I am so ill.
Yeah, the tense thing is always hard.
Yeah, yeah. But yeah, it definitely brought on more symptoms for me. I'm in daily chronic pain with my back now. Yeah. My pain is definitely worse than it was before, but it's just one of those things that we couldn't know how my body would react to it.
Well, it's a safety issue. If you have bits of metal in a failed fusion, we don't know exactly where they're going to go or whatnot. So yeah, it needed to be done.
Yeah,
but
regardless of my levels of pain prior or afterwards, it needed doing nonetheless. So
if you don't mind me asking, just because I know people listen to this who are going through some stuff, but like, can you describe what your low was? And I'm sorry for if you don't want to talk about it, that's fine.
Okay. As in my low,
like what your worst day was after the surgery. I know you've had ups and downs since then, but for you, what is bad, basically?
Well, after all the, being diagnosed and all of that, I also developed like severe dysautonomia.
Yeah.
And surgery only intensified that. But it also brought on cyclical vomiting syndrome.
Yeah.
And I remember one particular day after the surgery, we had run out of my nausea medication. And I was vomiting nonstop as if I had the worst food poisoning in the world. And I was sobbing. I was so upset. I just wanted my nausea medication to make the vomiting stop.
I'm so sorry.
Yeah, it was rough.
I had norovirus once and it was like the worst. I actually thought I might not make it.
I know.
So I can't even, and I've had, by the way, I want to be clear, like you're not the only patient I've had with cyclical vomiting syndrome. It is something which I suspect might occur more often if people are hyperwell. I don't know if there's research out there to prove it. Again, I'll maybe put something in the show notes if I can go check that out. But it's something which I do see more often in people who are hypermobile.
Right.
And it is not a good one to have to deal with. So you had that going on. You had the headaches. Can I ask you to describe the headaches just in case?
Yeah. I get a few different types of headaches. So the ones that are linked to my spine, they start in my shoulders, they go up through my neck, and then all the way around my head. They are like a throbbing headache. It's the kind of headache that you can't just function through.
Yeah.
And it's pretty much a daily occurrence for me now. I always have, whether it's a little bit better one day or a little bit worse the next, but there's always a headache present. And it like messes with my balance as well. It makes me feel dizzy. It's that feeling of like being drunk. Yeah. That's how I feel. And it's strange because you shouldn't think that you could feel a headache in your neck, but it's like my neck has a headache too. So there's that one. I get headaches in like my jaw area as well.
Yeah. Do you get like this thing, like where it's like
Yes.
Yeah, so trigeminal nerve distribution. So my worst headaches, it felt like someone was like strangling my eyeball. I don't know if that makes any sense.
It makes total sense. Yes. Yeah.
I don't think I've ever talked about Milo. I would like lie in a room with a pillow on my face in the dark, just like waiting, just literally waiting for it to end, basically. And the tooth pain, I thought I had tooth infections constantly. I'll do another episode on my whole jaw thing, but that really for me was like a very concerning thing. And this whole like I do this gesture to patients. I'm like, would you describe the headache like this? And when they're like, yes, I'm like, oh, like those are bad headaches. And we do have things called trigeminal neuralgia and other diagnoses. Some patients end up getting diagnosed with that. Others sometimes get tired and don't finish the diagnostic process.
Understandable though, isn't it?
Feels like Pokemon sometimes. Yeah. There's too many.
There is.
So with dysautonomia, do you mind if I ask cardiovascular stuff?
Yes.
Anything you want to talk about there?
I went under extensive testing for all of my dysautonomia stuff. Now, I do not know the specifics because it's overwhelming to go into all that detail in the papers, but I get the very typical super, super high heart rate upon standing. I am very breathless a lot of the time, which I think is a symptom that's not spoken about a lot, actually. But every time I stand up, I'm like breathless. The blood pressure drops and rises. It's, I'm feeling faint. But there's so much about my dysautonomia that isn't just like cardiovascular as well. Like there's the weirdest symptoms that I'm like, oh, I didn't know that was dysautonomia.
Did you talk about the gastro stuff?
Yeah.
Is it time?
I think we just gotta do it head on.
So we had to talk about this because
we did.
People look at me and they're like, wow, like she's well. Like I do all types of things at the gym. I'm like taking selfies. Like I look okay, right? But the gut stuff it's a struggle, and I know I get embarrassed about my situation. It's hard being a person dealing with this. I think it's hard being a young person, and I think it's hard being a young woman. Because we're not supposed to poo.
No, we're not. We're not supposed to use the bathroom at all.
Yeah, absolutely no. We just
let alone
roses.
Get on a podcast and talk about it.
So look, we're gonna do a little interlude. Okay, I'm gonna tell you about a little story about me, and then we'll get back to finishing on you because you were the star today. But and I have spoken about this once before. It randomly came up at a speaking engagement I was doing, which was wild. But basically, it made sense and it was right in the context. To be clear, okay. Anyone listening just looking to hire me, don't worry. I will not bring this story up if it is not the appropriate situation. Okay. But so I was 15, like you, and a lot of people are about that age, especially female patients or patients with estrogen dominant hormonal profiles. That's often when it starts because of how puberty can affect growth and hormonal profile and this and that. And I was constipated. I did not go to the bathroom. We were on a holiday, so I thought, oh, maybe it's just like the sunshine. Maybe I'm dehydrated, whatever. And then I came back. So the holiday was a week. I still wasn't going. I had a friend, Erin. I don't know, hopefully she never hears this. I remember I go for walks with Erin. We go on our bikes and just bike around the neighborhood. And I was like, Erin, because I didn't have anyone to talk to. And I was like, I haven't gone poo in 2 weeks. I'm really worried. And Erin was like, you should definitely talk with your mom about it.
I can't believe you waited 2 weeks to talk to someone. But I was being a teenager and
I was complaining. But again, when you're a child and you grow up with chronic issues, people stop listening to you and caring about you, and especially when you always have gut issues, they're like, oh, it's normal, she's always complaining about her gut. So I think I was a little bit ignored, to be honest. Again, love my mom, love my dad, they tried their best. I was not easy. I'm still not easy. Anyways, so then we go to the GP and they're like, oh, blah, 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 don't worry, it'll be fine. Very traumatic experience of actually having being inspected and looked at in that way. That was a whole thing. Anyways, I then continue. Luckily, it passes at 3 weeks. I then live the rest of my life. My gut issues get worse. And I have a family history of Crohn's disease. So I have a pronounced family history of gut issues. I was diagnosed with IBS when I was 10, and gastroesophageal reflux disease, again, when I was 10 years old. If you're listening to this and you are a child, you shouldn't be listening to this. But if you have a child and you're listening to this and they're getting these diagnoses, please speak to someone, because these kids need to be taken care of. And I had no support. But anyways, after that whole episode, my gastro symptoms got worse. There's something that really still causes me a lot of problems today. And I was shocked when I was doing my studies, starting to become a healthcare professional, learning a bit about the gastrointestinal system as part of my osteopathy degree. And I was like, oh my God, I could have died. There's a certain point where your intestines will just burst. Yeah, I know. I could not. Yeah,
I know. It's really terrifying information because I have been there.
Like, what a way to, like, that's such a sad way to go. So anyway,
can you imagine?
Dude, it was like, we were close. We were like this close, okay? And I had no idea. I don't think my mom knew how serious it was at the time. Like, this is why I'm very clear with my patients. Maybe sometimes I do stress them a bit, but I would rather that my patients were slightly stressed, but able to give informed consent and, you know, kept on the correct, like on the level, like we both understand what's going on, versus just being told like, it's fine, like, don't worry.
This is
because bad things happen sometimes. And anyways, my gut has not been right since. Yeah. And the reason that ties into dysautonomia is because your gastrointestinal system is controlled by your autonomic nervous system. And that's the part of your nervous system that does all the background functions. And how food moves through you is controlled by that system. In some people, it moves too fast. In some people, it moves too slow. And in some people, it does both. And believe it or not, for some people, it's normal.
Yeah.
There are people out there where it's normal. So yeah.
Yeah.
Anyways, I've told my story.
Yeah, you listen.
Now it's immortalized.
Mine's not far off from yours, you know?
Was it similar?
It's not far off. I mean, ever since I was a child.
Yeah.
And this is interesting. Again, it's just not something I ever took note of, but I was a very constipated child.
Yep.
Always. And I just never thought about it until all of this came up. And my mum was like, well, yeah, like, you've always been like this. And I was like, great, you know, really good. But it's got way, way worse.
Yeah.
I mean, normal for me is using the bathroom like once every 10 to 14 days, you know?
Yeah.
And I am on so many laxatives. I am on softeners. I am on, you know, the ones that help things move.
Yeah.
And I'm on natural supplements. Listen, if there is a constipation relief
everything.
method, I have tried it, okay? I have tried it. And absolutely nothing works.
Maybe this will be my next book.
Yeah,
Please
do us all a favor.
Dude, the anxiety about fiber too, like too much, because too much is really, really bad, but too little is also not good. And it's just like,
what's the happy medium there?
There needs to be a word for fiber related anxiety, like fibrosity.
Constipation, anxiety, like, and yeah, you know, it's not something that anybody wants to talk about, much less me.
No, I know.
You know,
I just want to like not have to be stressed about the bathroom. I just want to have a chill life. You know, I know some people, I won't say people, but like there are people in my life who just have normal bathroom experiences.
Must be nice.
Or when I do a medical history with a patient, I'm like, so tell me about your relationship with food. Tell me about your gut. How's all that? Like I'm asking some kind of gentle questions just to kind of, you know, talk about it in a thoughtful way. And when they're like, it's good. And I'm just like, okay, like I believe you, but I'm a little bit envious. I have to, you know, I'm thinking
jealous.
in my head. Yeah, I'm
so jealous. Yeah.
I once had a patient who could. It was an online appointment. They were like the most hypermobile person I've ever seen.
Yeah.
Like their fingers were like touching the back of their hand. It was wild. And I asked them about their gut, and they were just like, "Yeah, no, it's good." And I was like, "So you can like drink beer and eat chicken wings and be fine?" And they were like, yeah, like they were like, why are you asking me about my gut? Like,
I'm so jealous. What a life.
Anyway, so we talked about the gut stuff. You, with your back, so you were kind of in a dark place after the surgery. And we talked a little bit about, you told me something when we did our kind of pre-episode discussion about having to have that like long-term view of this is how your back is. How do you cope with that? Like, do you have any advice for people who are like trying to navigate this stuff with things that won't, you know, don't have the same scope for improvement?
You know, it's difficult because I'm still trying to navigate it myself. My life from 2020, 2019 up till now, I feel like it's just one big blur. I feel like my memory of the past 5 years is just gone.
Yeah.
And so the only way that I've been able to navigate it is those around me. I'm very, very lucky in that respect to have people that I can rely on and who are willing to help me when I'm not able to get out of bed. And, you know, that still happens all the time. You know, it's like, yeah, I'm here today.
Yeah.
But as soon as this is over and as soon as, you know, I am able to get to a bed, that is where I'll be.
Yeah.
So navigating it for me is really difficult, but I think the only way that I have got through it is finding health practitioners that I love and that feel safe, and B, and it's going to sound so cliche, and I'm so sorry. I'm sorry in advance to everyone listening, but truly it was about finding the joy in the small things I could do. It was about finding a TV show that distracted me for a while. It was about listening to music that made me happy. It was about, you know, my mom sitting in bed with me, and it still is. That's still what it's about. You know, I use a past tense, but this is all still happening. I think I'm using a past tense because I'm like talking about it in relation to the surgery.
It's weird trying to relate yourself to trauma you've been through and being like, I'm the same person, but also it's so complex, man.
Yeah, it's like, you know, and it's also admitting to yourself that you're still ill, and things aren't necessarily going to get better. That's just the way that these conditions can be sometimes, especially with the spine. I mean, doing damage to the nerves and, you know, the spinal cord and all of that. It's a lifelong thing. It's a genetic condition, you know, EDS and all of that is a genetic thing.
Yep.
I mean, I'd love if someone came up with a cure, but that's
me too.
But, you know, but I don't think that's going to happen.
No, it's hard. And in different patients, there are like different modifiable or not modifiable things. So your spine has been through trauma.
Yeah.
You have metal in there that affects how you move. It affects your posture. It makes it harder for you to hold your head up because of that curvature. So there are things going on which do affect, you know, your scope long term.
Yeah.
But you have found some things that help. Obviously, finding joy. I have to ask what TV show? What's like your guilty pleasure?
Oh gosh, I'm such a big TV person, like a huge TV person. I'm always watching something. But right now, I am watching a SEAL Team with my mom, and we are loving it.
I haven't seen it.
I haven't seen it. It's really good. But
Vampire Diaries.
Yeah.
Okay. It's I've been pulling up some old shows and making Dave watch them. He wants me to watch Lost. Have you seen Lost?
I've watched like a few seasons of it, but I like lost it halfway through. I need to go back to it.
You got lost?
Yeah.
I
got lost watching Lost.
We'll see. I got through the first couple episodes and I got bored. So we're going to try it again. Dave is very much a Lost fan. So those are my winter plans. But yeah, no, in terms of getting through, like you've also found some things that work for you and some things that don't. Yeah. I think that one thing you've done is quite remarkable, and a few of the patients that I've had on this season have done, is that you have looked for those second opinions or looked for those options. And again, it's hard because things cost money. They cost time, effort, and disappointment sucks. Also, regardless of all that, seeing that doctor, that healthcare provider, and then they're either not really, you know, helpful or it's a negative experience. It really, like, it's hard emotionally.
It's traumatic.
That is.
You know, I mean, I could go on about medical gaslighting for days. I could go on and on and on. But seek those second opinions. Yeah. Do it, because I would not be where I with medical practitioners right now if I hadn't done that.
Yeah. And sometimes even a third opinion. And again, it's like, I'm lucky in that I was able to get some treatment for it's all started with a wrist thing for me, but that I didn't think could be improved and I'd been told would not be improved. And it was just purely by chance. And I think just it's hard, but there's a lot of variability in the healthcare industry. There's a lot of variation in the quality of experience people have.
And this is another thing, particularly within the UK, is that you have the NHS and you have the private system. And I recognized that I was incredibly lucky to be able to access the private system.
Yeah.
You know, a lot of people aren't. And I don't think, me and my mum were talking about this the other day, I don't think that I even would have had the spinal surgery if I hadn't been able to access the spinal surgeon I did, because they missed it the first time. It wasn't the NHS the first time either. Yeah. But, you know, I think I was just very lucky. And if I hadn't gone to see him, would I have ever known that I am hypermobile and I have EDS? You know, it was him that brought it up to me. And so much beyond that, the treatment that I can access, all of that. And I just think that it's really unfair that some people can't access that. I recognize that I come from a very privileged position when I talk about that, you know?
Yeah. It's, absolutely being able to access private care gives more options. I think people always think it's better, and I hear sometimes really bad.
I can confirm that my worst experience was also a private practitioner.
It's more variable, I would say.
Yes.
There's like higher highs and lower lows.
100%.
And NHS has amazing people and brilliant healthcare too. Like the NHS highs are incredible. But there's like being sent out of A&E for headaches and stuff. And
I mean, I was there hallucinating spiders. I was literally sitting there hallucinating spiders. I was so scared. I was terrified, and I was just sent away. And those things happen. That's not a reflection of even the person that I saw.
Of course.
It's just the way the system is at the moment.
Some people fall through the gaps. That's what my mom said. Some people, you're that unlucky person. And we were talking earlier, I hope you don't mind me bringing this up, but like, you do look fine. Yeah. Like, I think you look fabulous. You look lovely. I know you don't feel that way, but it's really hard when you go into a healthcare situation and you look well, but you're not well. And it increases the risk, I think, potentially of people, not being taken as seriously. But then if you look really unwell, then sometimes you're also, patients ask me, what should I wear to an appointment? This is a social media question I get all the time. I don't know what the answer is.
It's a really, really difficult question because I do both. I'm not always well enough to put on makeup and look presentable, or even, I'm sometimes I'm not even well enough to get out of my pajamas, and this week, like I was saying to you before this, I got called out on it. I was talking to a practitioner this week about how unwell I've been recently. I've had a really rough go of it recently. I've been, just for context, I've been vomiting. I've had a really intense headache. I've really not been well. The dysautonomia is flaring up, and it's just been awful. And this practitioner asked me how I'd been, so I was telling him about this. Yeah. And he looked at me and he went, "But you look so well." And I left that appointment and I wanted to burst into tears.
I'm so sorry.
It was just demeaning when I'm sitting there telling you, not you, you generally.
It was not. That can be clear. It was
you
not
would never. Alex would never. When I'm sitting there saying how awful I've been and how ill I've been the past few weeks, to just be told, "Oh, you look great." So it's like, I'm not lying to you, Yeah.
It's hard, and then it's scary also because you've had things that just have turned out to be serious. I don't know about you, but in terms of, and again, my experience is different than yours. I'm not saying that to compare them in any way, but when you've had serious health events happen where you could have been in serious trouble, that fear of being told you look fine and then having it be missed, I think it's terrifying. Like I cry before appointments. I'm a hot mess. Like, I'm really good being the healthcare provider. In my role as an osteopath, I love that. I'm happy to advocate for my patients, and I try and support them. When it comes to myself, the anxiety is so bad.
I mean, advocating for yourself is a whole other thing. Like, I would fight for anybody else, but me, not so much. It's really, really hard to stand up for yourself, and I think it's the reason that, particularly so many females just get told, well, sucks to be you, you know?
You're fine or whatever. And I think sometimes too, people see like you can walk and you can do this, and it's like you've had to use every fiber of your being to be able to do that. And I hope you don't mind me saying this, but you sometimes do require assistance with activities of daily living. Like, because again, you do look lovely today, but I know you feel awful. But you're someone who, like, you do sometimes you need help to do things.
Yes, absolutely, I do. And like, it's been a process accepting that, accepting that, hey, I'm never going to be the way I was prior to all this happening ever again. And that is just the reality of the situation. And accepting that as someone who was 20, 21 years old. I'm 25 now, but I've spent the whole first half of my 20s just in this like existence of everyone else's life around you is going on, and everyone's moving forwards, and you're just stuck between medical appointment and waiting for the next medical appointment and the next one, and then invasive testing and then results. It's an acceptance thing that, okay, well, I'm going to take all the help I can get at this stage because I need it,
No, absolutely. That kind of, I don't want to say like purgatory, but it's like you're waiting, you're constantly, you're just trying to get answers. And I know there's that stress too of having to chase for letters, or the results don't come through, or the appointment is scheduled wrong or something. It's like, it is the worst. Again, it's a privilege to be able to have healthcare, but it really is, it's not a pleasant admin.
It's not. It's like you're just in this endless time loop of going from appointment to the next appointment, and just,
In terms of your health, is there anything that you've found has helped you? I know we talked about pillows and supports. I do think being aware of that. I know it helps me. I don't know if it helps you at all.
It does.
If you do need more supports, tell me. I'll go. We'll get towels.
As long as I have my pillow, my trusty pillow on my lap to support my arms.
But have you found anything else helpful? I know some patients will find manual therapy helpful. Some patients find exercise helpful. Tell me what's benefited you.
Well, exercise is a big no-no for me, as we know.
Yeah. And that's okay. The whole idea that everyone has to exercise is not good. Some people cannot exercise. Some people need to exercise in very specific ways, if at all. So again, as much as I am personally very sporty and I love fitness, it's like we have to appreciate that everyone needs to be treated differently. Post-exertional malaise is real.
Yes.
And we need to be sensitive to this and not make people feel bad because they can't exercise.
And that's one thing, definitely, that the first practitioner, one of the first ones I ever saw, the chronic fatigue syndrome, I do experience post-exertional malaise. So things like I have to be really careful with how I spend my energy. And that's one thing that does really help me is pacing. So important.
How do you do that? Tell me about it.
Do you know what? I think I've just become really attuned to how my body feels. I can feel when I'm doing too much and I stop. I say no to people. And that was hard for me. I am a big people pleaser. Big. So for me, saying no to people is difficult. It makes me so uncomfortable. But I do it now because I have to. If I don't, I will pay the price.
Yeah.
So pacing is a big one for me. Rest, lots of rest, obviously. But also seeing you is incredibly helpful for me.
Oh, well, thank you.
No, but I'm not just saying that. Like,
you're not paid to be on the show. You're here
I am here out of my own free will. I am not sponsored.
This episode's actually, if anyone wants to sponsor it though, I'm just saying there's a space available. But yeah, I do manual therapy basically, but being very sensitive. I have metal in my jaw and I have had people not be sensitive to that, and I can feel the screws, and I had an infection in it. So again, not like your case, but I had a serious bone infection, which was quite a scary thing to go through. And I think that sensitivity around you having metal in you and being thoughtful around that, especially because you also do have altered sensation on your back, so you can't always feel where my hands are. So I tell you, I'm like, Ellen, I'm gonna put my hand here, is that okay?
It's really weird. That's one thing that just never came back. It's just feeling in my back. So weird.
Nerves are quirky and strange,
so odd.
But yeah, so manual therapy. I have to say I do active release techniques again. They don't sponsor me. I pay money for the certifications with them, but it is different than normal like massage or soft tissue treatment, and I quite like it. And we look sometimes at peripheral nerves and how they relate to structure. So again, I think, for me, if I got treatment, it would be that type of, and again, that's just one type. There are many different ways that manual therapy can be done. That's just the type that I do. But that, and then, tell me what else you found helpful.
I see a jaw physiotherapist, which, by the way, I didn't even know existed until a few months ago.
There's a lot of, London has a lot of different healthcare niches.
It does.
And how's that going?
Really well. Yeah. Really, really well.
What's it involve?
So we do a lot of different things. She does kind of manual therapy on my jaw, like mobilization. She does dry needling. She does I was trying to think now what else.
Does she do internal jaw treatment?
Yes.
Love it.
She does.
That is a niche. See, I actually don't do that because I don't feel competent to do it, because I would need to take extra courses and I don't have time and I'm very tired. But also there are brilliant people like this specialist who specialize in it.
Yeah, and she's wonderful. She is. And we've spoken about it. I've said to her, how does one get into this? And she said she kind of fell into it and she just loves it. And honestly, I think, if anyone takes anything from this, jaw physiotherapists exist and they're great.
Yep. And it's an issue that affects a lot of patients. So a lot of people, they can't open their jaw as wide as we would expect them to. So it affects chewing. Oop, I'm touching the mic now. Or we can have instability in the temporomandibular joint and so on. So jaws are very important.
Yeah, I mean, I have all those things. Yeah. My jaw, when I turned up to her, she just took one look at me and she basically said, hey, not in these words, she was very professional, but she said, hey, this is a mess. Because by the time people get to her, because it's such a niche area, by the time people find her, it's severe.
I wish, again, the healthcare systems, they all, this is not me criticizing dentists in any way, but I wish there was more assessment of the temporomandibular joint by someone.
Absolutely.
Like, because I'm often the first person who's looking at it in a patient, and I wish, I'm not like a person that people will regularly see often or see earlier on until they're in quite a bit of pain typically. But like, we need to be checking people's jaws because it affects their life, basically.
I mean, I wish that I'd had mine checked earlier. You know what I mean? I have issues with chewing. I have very limited mobility in my jaw, as we know. And it's a really big source of pain for a lot of people, and it's just not spoken about. Apparently I'm very passionate about jaws.
Ellen, I'm trying to get you to go into a healthcare field.
I know you are.
I know law is calling you, but we would be very happy to have you in the healthcare sector, okay?
I wish I was scientific enough to be able to do it. I just don't think I am.
Life is long. You never know. You never know.
10 years down the line, we'll reconsider.
Speaking of another topic that I think we're passionate about, female-specific health or uterus, ovary-specific health, estrogen-positive stuff. Tell me about that and how that's affected you, because I know we discussed that before.
My whole life, my periods have been absolutely awful, and I mean horrific. I remember being like 14, 15 and lying on the floor sobbing in so much pain because of how this was making me feel. It was just awful, and that's just been an ongoing issue for me my whole life since I started getting periods.
I'm going to ask you the question that I always have to ask my patients, which slightly annoys them, but that's okay. Did you mention it to your doctor?
Yeah.
What did they say?
They put me on birth control.
That's the classic thing.
I'm no longer on birth control. Because I absolutely refuse at this point. Because I'm pretty sure the birth control made things even worse. My body hates it.
Yeah, and some people get on with it, some people don't. And again, I'm very pro people having access to every possible type of treatment and what's best for them. But I have to say, anecdotally, I was on hormonal birth control for 10 years. And for me, and I haven't talked about this much, I am doing an episode, I think, myself later this season. If the Alex show will be back. But for me, my first thing that I seemed to kind of be able to change in my body or improve were my cycle issues. I came off hormonal birth control. It was chaos. It took me 2 years to sort it. But that type of not getting on with it, my pain in every way was much worse when I was on hormonal birth control. I was much less well. And again, if you're someone who's on it and you love it and it's working well for you, that's fantastic. I want more options. I want all options.
Honestly, if it works for you, then genuinely that is incredible. I wish it worked for me,
Exactly.
And against my better judgment, I went back on it a few months ago because my gynecologist suggested that I try it again, and I was like, you know what? What's the worst that could happen? Well, I'll tell you what's the worst that could happen. It's a 2-month period.
Oh no! Yeah. Oh, you're bleeding. Oh, jeez.
Yeah. It was rough, so I stopped that. But I've always had these issues, and I wish I could sit here and say that I've got to the bottom of them. I haven't. We're in the process of doing it. I had some hormone tests done recently, and those came back abnormal. So we're getting there, but. It's such a, this was like the out of the list of all the things wrong with me. It was just at the bottom, and we're getting round to it.
That's why when patients get judged for like, oh, well, you should have spoken to someone else, or why did you? They're tired. They have a lot to deal with.
This is the thing, I'm dealing with all the medical appointments that we have to go to, all of the medical letters, all the medical admin stuff that comes with it.
Also your studies. And being a 25-year-old woman and you're not in London yet, and you might be moving here soon, but hopefully. It's you have a lot. It's a lot to deal with.
It is a lot, and I'm dealing with being ill at the same time. So, how much we can get around to doing and how many appointments we can attend is way less than the average person because I can't physically do it. So, we do things in list of priority, and priorities number 1, we're dealing with being diagnosed with hEDS and the dysautonomia that literally, if anyone has a magical cure for dysautonomia, let me know, because it ruins my life. It is awful. Priorities.
My semi-magical cure would be that, like, again, this is me joking, to be clear, okay? But pressure and lying down is nice. So if we could just all be like mermaids on like a fantasy mermaid island, that is my
But you know what? That is the only time that I ever feel at rest. is lying like a little plank of wood in my bed.
If I win the lottery, I will make Hypermobility Island.
Please
and
do.
People can just like.
Please do.
We need like no stairs in the swimming
God,
pool.
no
Absolutely
stairs,
not.
please.
We need
No
like
stairs.
the beach style entry. Yes, and like nice, like warm, not hot, but just
Warm
correctly
water.
temperature water. Yeah, where
Yeah,
I'm on
heaven.
it. I'm on the case.
Yeah.
But we didn't really talk about your like diagnosis of hypermobility
Right.
stuff.
Yeah.
You say EDS. Do you
Yeah.
mind if we talk about?
Let's do
that?
it.
Yeah, tell me.
Let's do it. So I don't know why we didn't touch on this earlier. Actually,
It's a lot. This
there's-
episode proves
yeah.
there's a lot.
This is the thing, there's so much to get to. Yeah. So my spinal surgeon suggested it to us. So we did a little Google search. I mean, I remember that day coming out of the appointment with my mum, and we sat down on the bench outside and we looked it up. We had, this was the first time we had ever heard these words. And it was like a checklist. We were like, oh my God, this is me. So obviously we went to look for specialists to try and see if I had it, see if I, would be diagnosed with it or not. The first person that we went to was a disaster. And it set us back for months and months and months. We went in there. This person took one look at me and said, nope.
Really? Jeez,
Yeah.
I blocked that out of my memory somehow.
Yeah.
That is, I'm so sorry.
So we were like, okay, we were wrong. I guess I don't have it then. Anyway, months down the line, someone else suggested it to us and they gave us a different person to go and see about it. So we went to a different person and that person was like, yep. And they diagnosed me. See, now this is a thing.
Yep.
I don't know what I have. Okay. He diagnosed me with HSD because, and I'm not going to rant about the Baton scale. Okay. I wish I could.
I have a whole episode on it. Have you heard it?
Yes, I
it's a
have heard
whole
it.
45-minute rant on the Baton scale.
It's awful, okay? And to be clear, the reason that I didn't meet the hEDS diagnosis was because my hands aren't bendy.
Yeah.
However, if they had taken one look at my ankles or my hips or my neck or my shoulders,
Yep. And different.
yeah, we'd have a very different outcome. Apart from that, I hit every single, criteria that you have to hit. So every other doctor I've seen, they've just said hEDS.
Yeah.
But technically HSD. But he basically said it is EDS, but I can't formally write that.
Yeah, and it's quite a problem right now, in my opinion, because we have these diagnostic criteria, the 2017 criteria, and the distinction between HEDS and HSD is quite problematic, in my opinion. Hopefully, the new criteria will improve upon this. I'm very hopeful. In the UK, the situation is such that the diagnosis, whether HEDS or HSD,
It's treated the same.
it doesn't matter because there's no nice guidelines. So people
No.
think the UK has really, really good healthcare. And yes, it's better than many other places. But if you are on the public system, the NHS, and you say, hi, I have an hEDS diagnosis or HSD, there is no pathway for you. You're at the mercy of your doctor or whatever, lucky referrals you
You
get.
just got to hope you get a good,
At best, patients tend to get referred, and I believe this is the current guidelines. So there's the
pain management.
the pain management clinic, and then like a local physiotherapy team, and they're often not equipped or trained to deal with this.
I've heard a lot of people say that the physio teams do reject them and say that they don't take EDS patients.
Are you serious?
Yeah.
Serious? There's it's the GIRFT getting it right the first time guidelines too. So for rheumatology, they typically won't see people now who are hypermobile. And I'll never forget, I had a 21-year-old patient and I saw her, and I'm pretty good at knowing when to be worried about a patient and when to be less worried at this point. And I was concerned about her, and I told her, I said, look, I know this is hard, but you have to talk to your GP. I want you to have that referral. You need to be seen by a specialist and diagnosed. The GP did the referral. Everything was great. I was shocked because I did not expect the referral to happen. And then she gets a letter from a rheumatologist being like, we're not going to see you. You have hypermobility. Go to your local physio team. And I was worried about her heart. I was concerned. So then we tried to refer to cardiology and whatnot, but it was it's that we need someone diagnosing this and looking at it.
This is the issue that we've come across in the 5 years that we've been dealing with this. That there is no one person managing my healthcare. We've got, 10 different specialists or whatever the number is, and everyone is doing their little thing. But when it comes to somebody overseeing my care, it's just not there. Nobody exists to do that. And that's rough sometimes.
Yeah,
because,
I think it's rough
you know,
all the time.
Yeah, it is. That's me with my positive outlook on life.
Sorry to be a downer.
No, but you're right. You're right.
But look, hopefully in future, we'll start to get some, management. I think I hope we'll see more GPs or maybe a dedicated. I'd love to see a connective tissue system specialist. So I once had a patient, again, a young woman in her 20s, and her parents are both medical doctors, and she asks me, she's like, why is there no connective tissue specialist or something? And
Why
I said,
isn't there?
Yeah, but you know what I said to her? I said, both your parents are medical specialist doctors. I'm like, ask them and see what they say. And she asked them, and I'm like, what did they say? And she said that they said that it's because it would be too hard. And I don't think that's an acceptable. I think we need to.
It's not fair.
Yeah.
There are so many people out there who need it.
Yeah.
And I'm sure it would be hard, but
we can do hard things.
Yeah,
I believe when we try hard, we can.
And I mean, surely it's harder to have patients coming in every day saying, I need help.
And the things that get missed from all this disparate care and the complexities in that, I think it would make a lot of sense.
Yeah.
So there are, I can think of a couple private GPs, I think, in the UK who do have a connective tissue specialist interest who are trained that way. I think they're all not taking new patients right now because they're overwhelmed and fully booked. But hopefully maybe we'll even see that type of pathway occur because it would make a big difference.
It would make a huge difference. I mean, I would have loved to have had that back when I had no idea what was going on with me,
I know.
But there's dysautonomia specialists. There's specialists for everything else. So why?
We need that connective tissue thing. But we'll see, Ellen. Yeah. I honestly couldn't continue to work in this field if I didn't have hope. That is the thing.
I don't think I could get on with daily life if I didn't have hope.
That is the thing.
At some point, someone will do something to reduce the pain and reduce the fatigue,
For now, we will survive on hope and Vampire Diaries reruns.
Yeah, we will.
Ellen, look, we're going to have to wrap it up there for today. Last question, promise. Yes. Is there anything, if you could go back to little Ellen, when you were really, really struggling, is there anything that you'd want to tell yourself in those kind of darkest moments?
I think 2 things.
Okay.
Number 1, trust yourself. Mm-hmm. And this is literally for everybody listening, okay? Trust yourself. If you think that something is wrong, you know best.
Yeah.
And doctors are incredible people, and I'm so grateful for so many incredible doctors, but they're not the be all and end all.
Mm-hmm.
They get things wrong sometimes. If you know that something is wrong with you, go get those second opinions, go get the third, go get the fourth. If you know something is wrong, keep trusting yourself and keep advocating for yourself. And my second one, and this is something I need to remember more and stop having existential crises all the time, is to enjoy the little things. Like I mentioned earlier, I think it's really the only way to get through something like this is slowing down and just trying to enjoy the little things in life, because without those it just becomes very miserable very, very quickly. It really does.
I could not agree with that more. Okay. And look, you being the expert of you, what I can say is really competent healthcare providers, they will never feel threatened by an expert patient, because your expertise and your existence of yourself in your body does not take away from a healthcare professional who is, competent and secure in that competence. They should not feel threatened or intimidated.
No, they shouldn't.
And the best patient practitioner relationships are where the patient, often sometimes an expert patient, especially in the chronic pain world, because you have to become that, you get to work almost collaboratively with a healthcare provider who has their expertise and is working with you and using, your expertise to help inform their management of you and your insight of your body that you've had to go through so much to really have now. Yeah. So I fully agree with what you're saying. I love it. Ellen, we shall wrap up there. Thank you so much for being with me here today.
Thank you for having me.
And it's been lovely getting to talk with you about all this. And for anyone listening or watching, I will see you next time. Take care.